Administering glucagon in an emergency situation is a key skill in diabetes care. And just for background, glucagon is a hormone also made in the pancreas that instructs the liver to convert glycogen stores into glucose that can be released into the bloodstream. And this helps somebody who's experiencing a very severe low, meaning that they might be having a seizure or unconscious or unable to swallow a rapid-acting carbohydrate. It helps to raise their glucose levels. Now, remember, when you're administering an emergency glucagon, it's usually happening in a time of stress. And so the good news is that there are some newer formulations of glucagon out now that make that a simpler task. Now, the first is a nasal powder formulation of glucagon called Baqsimi. It actually comes in a yellow container that looks much like this one, and that it's sealed around the top. Now, you want to make sure that it is sealed before you use it because it's a powder, and we want to make sure that that seal is intact so that we know that no moisture has gotten to the powder inside the container. To administer this drug, you're going to remove the lid, pull out the device, which is again sort of featured here, but this is a tester model, so it would be in yellow. You're going to place your fingers on the top here, insert into the nostril with your thumb down below, and simply compress to release the powder into the nostril. You're going to turn the person on their side and call 911. This drug is indicated for children ages 4 years and older, and the good news about this sort of very simple to use packaging is that there were very few mistakes in the usability testing they did. The second glucagon formulation that is fairly easy to use, in fact, in usability studies, 99% of people got it right, is a drug called Chibok, and it is a liquid stable glucagon. Now, Chibok comes in 2 doses. The first is an adult dose, or 1 milligram, and the second is a pediatric dose, or half a milligram. The pediatric dose is for ages 2 to 12, and then the adult dose is for ages 12 and over, although there is a weight recommendation, and so the adult dose would be for people 45 kilograms or more. Let's look at the device. So the device looks like a very small subcutaneous syringe, which it is. This is the pediatric dosing device. What you would do is remove this safety here. That allows the syringe, it makes the plunger active. You would take off this needle cap, inject directly at 90 degrees into the leg, upper arm, or abdomen. Go ahead and compress the plunger completely until all of the liquid is injected into the person. Don't worry about air bubbles. Count to 5. Remove the syringe at 90 degrees and dispose of safely in a sharps container. You're going to turn that person on their side in the event they might vomit and call 911. The third type of glucagon used in emergency situations comes in a red or orange kit that many of you are familiar with. This is a glucagon that is not stable in liquid form, and so it needs to be reconstituted or mixed up. If you look in this kit, you'll see that there's 2 pieces. There is a syringe filled with a diluting liquid, and then there is the glucagon in powder form in this vial. The steps to take here, and you should definitely review the app or the video. There's a link back on the website. But you would take the contents of this syringe by removing this needle cap, and you would inject them into the vial. You would then remove the syringe and mix up the contents until they were completely mixed together. Once it's been reconstituted or mixed together, this glucagon is good for 24 hours. You would then reinsert the needle into this vial and draw the liquid glucagon out and administer in the leg, arm, or buttocks. Again, turn the person on their side, call 911. Remember, with any form of glucagon, you cannot overdose the person who is having a severe low. The key is having the confidence and a calm state of mind to be able to administer the type of glucagon that has been prescribed. You've seen the types that are available. Talk to your diabetes care team about prescribing one that you feel most comfortable with. And again, be sure to watch the manufacturer's videos, read the websites, download the apps in the case of the older version, the kit that you have to mix things together so that you are prepared and ready in the event of an emergency.